This is still chapter 23, and we are still on electrolyte balance, but this talk is going to focus on potassium, chloride, and other anions. So first, we're going to talk about the regulation of potassium balance. And so before we even get into the regulation, we talk about the importance of potassium. And it is going to affect the resting membrane potential in neurons and muscle cells, and this is particularly true for cardiac muscle. Increases in extracellular potassium or hyperkalemia will cause a decrease in resting membrane potential, causing depolarization, followed by reduced excitability. Decreases in extracellular fluid potassium or hypokalemia will cause hyperpolarization and non-responsiveness. Disruption in potassium in the heart can interfere with electrical conduction and lead to sudden death. Potassium is also part of the body's buffer system. Hydrogen ions shift out and in the cells in opposite direction of potassium to maintain cation balance. So when extracellular fluid potassium levels will rise with acidosis and fall with alkalosis. And this will interfere with the activity of excitable cells. So the regulatory site is going to be the distal convoluted tubule in the collecting duct, and potassium balance is controlled in the cortical collecting ducts by regulating the amount that is secreted into the filtrate. High potassium content of extracellular fluid will favor principal secretion of potassium. So when potassium levels are high, secretion is favored. When potassium levels are low, the principal cells will reduce secretion to a minimum. In addition, type A intercalated cells can reabsorb some potassium that's left in the filtrate. Kidneys have a limited ability to retain potassium, so most of the potassium is lost in the urine, and this may lead to a deficiency if it's not replaced in the diet. The most important factor affecting potassium secretion is its concentration in the extracellular fluid. A diet that's high in potassium will increase potassium content in extracellular fluid, and potassium entry into the principal cells will lead to increased potassium secretion. So if the person consumes a lot of potassium, then potassium will be secreted. A diet that's low in potassium or accelerated potassium loss will reduce its secretion and promote its limited reabsorption. Remember, it is limited. Aldosterone stimulates potassium secretion by principal cells. The adrenal cortical cells are directly sensitive to potassium content of the extracellular fluid. An increased potassium in the adrenal cortex will cause the release of aldosterone, which will increase potassium secretion. This means that potassium controls its own extracellular fluid concentration via feedback regulation of aldosterone release. We move on to talking about calcium and phosphate. So 99% of our calcium is found in bone as calcium phosphate salts. And calcium balance, as you may remember from either AMP1 or chapter 16, is controlled by parathyroid hormone, and it rarely deviates from normal limits. Parathyroid hormone is going to increase calcium levels by targeting bone. It's going to cause osteoclasts to break down the matrix, which is going to release calcium and phosphate to the blood. In the kidneys, by increasing calcium reabsorption and decreasing phosphate ion reabsorption. And in the small intestine, by increasing calcium absorption. 99% of filtered calcium is reabsorbed due to parathyroid hormone. If extracellular fluid calcium levels are normal, parathyroid hormone secretion is inhibited. 75% of filtered phosphates are reabsorbed in the proximal convoluted tubules, and parathyroid hormone inhibits this by decreasing the transport maximums. Phosphate reabsorption is also affected by insulin. It increases it, and glucagon, it decreases it. So in a circumstance where there is low blood calcium, this is going to cause the parathyroid glands to secrete parathyroid hormone. This is going to increase osteoclast activity in the bone, which is going to release calcium and phosphate into the blood. It's also going to cause an increase in calcium reabsorption in the kidney tubules. And it's also going to lead to an increase in absorption from food in the small intestine. And all of this is going to increase calcium levels in the blood. Chloride, so now we move on to talking about anions. Okay, so now we're done with cations, we move on to anions. Chloride is a major anion accompanying sodium in extracellular fluid. It helps to maintain osmotic pressure of the blood. 99% of chloride is reabsorbed under normal pH. It passively follows sodium in the proximal convoluted tubule, and is coupled to active transport of sodium in other tubule segments. When acidosis occurs, fewer chloride ions are going to be reabsorbed in lieu of bicarbonate. Other anions have transport maximums and excesses are excreted in the urine, and examples of this are sulfates and nitrates. And that is all I had for this video. There are no questions.